Today is day 16 of the government shutdown, and yesterday during the CNN town hall, Alexandria Ocasio-Cortez was asked whether she believed illegal immigrants should receive taxpayer-funded healthcare, and you are not going to believe what she answered. What's up, guys? Welcome back to Military Insider. Let's take a look at this real quick. Listen to this.
I think that taxpayers should be paying for the medical care of immigrants that are in the country illegally.
Pretty much she's asking if Alexandria Ocasio-Cortez believe if illegal immigrants should receive taxpayer-funded health care. All right, let's keep hearing.
Thank you.
Well, we already know, and this is a common lie that Republicans have been repeating, that this shutdown is about Democrats trying to provide health care to the undocumented. And we already know that it is federal law and federal statute that undocumented people cannot be covered by the ACA. They cannot be covered by...
She's right. She said undocumented people under the federal law cannot be covered under those programs. But I'm going to show you something in a minute. Stay
Medicaid,
with me.
They cannot be covered by Medicare. Period. That is the law of the land.
If you could choose, do you believe that the federal law should be...
She did not answer the question, and they asked her again.
I believe in a single-payer healthcare system where if you go in and you need a doctor, you can get the medical attention that you need.
Yes, I believe that as well. If you need medical care, I believe that you can go to an emergency department and get the health care that you need. I'm completely 100% with AOC on that one. But this is the funny part of it. I'm going to show you something. She was right. Under the federal law, prohibits undocumented immigrants from accessing federally funded health coverage like Medicaid, Medicare, CHIP, and the ACA marketplace. However, undocumented individuals can receive emergency medical care through a program called Emergency Medicaid, which reimburses hospitals for treating life-threatening conditions, and they have the right to emergency care regardless of their ability to pay or immigration status under the Emergency Medical Treatment and Labor Act, EMTALA. All right, so let's take a look at what EMTALA is. Emergency Medical Treatment and Labor Act is a federal law requiring hospitals with emergency departments to provide a medical screening examination to anyone who comes to the emergency department requesting care, regardless of their insurance or ability to pay. If an emergency medical condition is found, the hospital must provide stabilizing treatment or an appropriated transfer. We are good for now, right? Everybody is covered under this act, the EMTALA, right? So let's keep reading. What the requirements for under EMTALA: medical screening examination, stabilizing the treatment, no patient dumping. Pretty much you cannot turn them away, appropriated transfer, and active labor. Okay, if a female is pregnant, they should be able to medical screen the patient and stabilizing. Okay, so now let's take a look at these. No one specific entity pays for EMTALA services. Rather, the cost is borne by a combination of hospital and physicians, with the financial burden being shifted to other patients, insurance companies, and sometimes through public subsidies. So pretty much nobody's paying for this program, but the cost is a combination of the hospital and physician, with the financial burden being shifted to other patients, which mean you and me that have medical insurance, right? So hospitals and doctors are required to provide screening and stabilizing treatment to patients with emergency condition regardless of their ability to pay, and they bear the financial shortfall when a patient is unable to pay or does not have the insurance. So pretty much under the law, the undocumented people are covered to get the medical treatment, but nobody is, at least the hospitals and the physicians are not able to get the reimbursement for those treatment provided to them, okay? So now, look at this. Who pays the direct cost? Hospitals and physicians. They provide the care and are initially responsible for the cost, even if the patient cannot pay. They can still bill the patient for services received, but they are often unable to collect the payment, creating a financial shortfall for the physician and the hospitals. Other patients and their insurers. The cost of unreimbursed IMTALA care is often passed on to other patients through higher hospital fees and increased insurance rates. So pretty much all those costs that are not reimbursed to the hospital and physicians are often passed through the other patients like you and I that have insurance. How they do that? They raise the hospital fees and they raise your insurance rates. So pretty much is taxpayer dollars that fund this program. How costs are managed or subsidized? Government subsidized funds from federal, state, and local governments may use to subsidize hospitals that serve a high number of uninsured or low-income patients. Public programs. These include programs like the Veterans Health Administration and state or local indigent care program, philanthropic donations. Okay, now, who paid for this bill? This is from, let me see, Emergency Physicians Monthly, okay? Who pays the tab for unfunded care? Let's take a look at this. But they, let's go up here. But they are not selected by their business code for specific responsibility to provide life-sustaining food to those who cannot or will not pay for it. Through charity programs, the government has taken on the burden of making sure that the least fortunate of its citizens are fed. But the burden for such is borne proportionally among all its citizens. And those who fail to take advantage of this system of charity are simply out of luck. Not so with emergency medical care. Instead, the cost of unreimbursed IMTALA care is shifted from those who cannot pay to those who can, skewing costs for everyone. The problem here, again, is inequality. Hospitals in areas with a high indigent population must shift more of the cost of unreimbursed care than those in areas of low unreimbursed care. It's like increasing the taxes in poor areas and lowering the taxes in affluent areas. Furthermore, since the bills are different with each patient, some will receive a higher proportion of shift than others. It's like raising taxes on the sickest patient just because they have the ability to pay. So pretty much what they're saying here is like raising taxes on the sickest patient because you and I have the ability to pay for those who cannot. Does this make sense to you? Let me know in the comments. I really want to see your opinion. I really want to know your opinion on this one. I believe that everybody should be able to walk into a hospital and get the treatment they need. I'm 100% with that. But why we have to pay, why they have to increase our fees, hospitals, premiums, and all that to the American citizens that we are the working class? That's something that I really don't understand. I think the government need to shift some of the money to get this done. I don't know. I mean, look at the politicians or something. Just keep them under 2 terms. I don't know. Trying to find a way to pay for this, but not take the money from the taxpayer to pay for this. This is, I don't know, but this doesn't make sense to me. Let me know in the comments. I really want to know your input on this. Let's take a look at this. This is the National Immigration Law Center. So, did the law cut off undocumented immigrants from emergency care funds? No. It is states and hospitals that lose funds. Under federal law, someone in a medical emergency cannot be denied care, of course, because of the IMTALA Act. Doctors and hospitals that provide this care typically will get paid for this care afterwards by the patient's insurance company or by a program like Medicaid. However, because many immigrants, both lawfully present and undocumented, are excluded from Medicaid, doctors would not ordinarily get paid for providing emergency care to them. So pretty much the physicians and the hospital have to provide the care for the undocumented, even though they don't have the ability to pay. And they will not get reimbursement unless they charge the taxpayer that do have a medical insurance. You're following me? Now, let's take a look at this about the EMTALA controversies. So it's saying the main controversy surrounding EMTALA is that it was presented and enforced, but care was not funded by the government. That made hospitals and physicians responsible for the emergency services. They are responsible for the service, but not for the payment. Services they provide, but not which they could not collect payment. Uninsured people have increasingly dependent upon hospital to care for them when they are ill or injured, even in non-emergency situations. Wait times have increased and hospitals are burdened with further expenses. Some expenses are passed on to other patients through their higher hospital fees and increases in insurance rates. That's what I'm going right now with this statement from the EMTALA Act. I think, like I said before, I believe everybody should get the treatment when they walk into a hospital, but why do I have to pay for someone that doesn't have insurance? I think the government or the state, the federal law, state law, they need to come up with something to allocate funds for this, not from the taxpayer. This is insane. Lastly, how EMTALA is funded by taxpayers. Cost shifting to insured patients. Look at this. Hospitals shift the financial burden of uncompensated care to other patients with private health insurance. The increased costs are then passed on to consumers through higher premiums and deductibles and other fees. Once again, the EMTALA Act is in place and still working. Anybody can go to a hospital and get medical care, but the cost is shift to insured patients. I think this is something that needs to get fixed ASAP. I'm 100% with AOC on this one, that everybody has to be able to receive medical treatment in a emergency department, but not paid by the taxpayer. I don't think it's fair. Let me know in the comments what you guys think. Make sure to hit that like, hit that subscribe, and we'll see you guys on the next one. Stay safe.